What health services count towards your health insurance deductible? Understanding health insurance can feel overwhelming, especially when it comes to terms like deductibles. A health insurance deductible is the amount you pay out of pocket for certain covered health care services before your insurance kicks in. Not every service counts towards this deductible, and what does can differ from one insurance plan to another. Generally, the deductible applies to covered services where you pay either the full or partial costs until you reach that deductible amount. Once you meet your deductible, you typically pay co-insurance or co-payments, while your insurer covers the rest. It's important to note that preventive care services usually do not count towards your deductible. These services are often fully covered without any cost sharing. So, what types of services typically count towards your deductible? Physician visits for illness or injury are included, but routine checkups are not. Hospital stays and inpatient care also count, along with outpatient procedures and surgeries. Emergency room visits usually apply, though some plans may exempt certain emergency services. Additionally, diagnostic tests and lab work ordered for treatment purposes count, as do durable medical equipment like wheelchairs or oxygen. Certain prescription drugs may also count, but this can vary by plan, as some have separate drug deductibles. Specialist visits related to treating illness or injury typically count as well. On the flip side, there are services often excluded from the deductible. Preventive care services, such as annual wellness exams, immunizations, and screenings mandated by the Affordable Care Act, do not count. Routine checkups and well-child visits are also excluded. In some plans, emergency services may be covered without applying to the deductible. Hearing aids, prosthetics, and related supplies might have separate coverage rules. Prescription drugs can have their own deductibles or co-payment structures, especially in Medicare Part D or certain employer plans. Services received from in-network providers may sometimes only requiring co-payments and not count towards the deductible, depending on your plan. If you are enrolled in Medicare, there are specific rules to keep in mind. Medicare Part A has a deductible per benefit period that applies to inpatient hospital stays. For 2025, this is set at $1,676. Medicare Part B has an annual deductible of $257 that applies to outpatient services, physician visits, durable medical equipment, and other services. Preventive services covered by Medicare Part B are typically exempt from the deductible. Medicare Advantage and Part D plans may have different deductible structures. Understanding which services count towards your deductible can help you anticipate your out-of-pocket costs. Remember, preventive care is often fully covered, meaning you don't need to meet your deductible first. Services received out of network often come with separate deductibles or higher cost sharing. Keep in mind that deductibles reset annually or per benefit period, like in Medicare Part A. In summary, health services that count towards your health insurance deductible are generally those covered services for treatment, not preventive care, that requiring you to pay full or partial costs until you meet the deductible. Always review your specific plan documents to know exactly which services apply to your deductible, as plans can vary widely.